Children are not just small adults. They need special care, especially during medical procedures. This is especially true in anesthesia. Imagine a child facing surgery. They are scared. The hospital feels big and strange. As an ODP, you play a vital role in making their experience safe and comfortable. Children have unique emotional and physical needs. Their bodies work differently to those of adults. They process medications differently. They even feel pain differently. That's why understanding pediatric anesthesia is so important. It's about providing care that is tailored to each child's age, development, and medical history. It's about making sure they are safe, comfortable, and supported throughout their surgical journey. Remember, a child's experience in the operating room can have a lasting impact. By providing compassionate and child-centered care, you can make a world of difference. Imagine a child who is about to have surgery. For them, the hospital is a strange and unfamiliar place, filled with new faces, bright lights, and unusual sounds. They are already scared and unsure of what's happening. The anxiety can be overwhelming, not just for the child, but for their parents as well. Now, imagine trying to explain complex medical procedures in language they don't understand. Medical jargon can sound frightening and confusing to young ears. It's no wonder children can feel overwhelmed in the hospital. Their emotions can quickly escalate if they feel lost or ignored. That's why clear communication is crucial in pediatric anesthesia. It helps to ease fears and build a sense of safety. But it's not just about using simple words. It's about making sure the child truly feels heard and understood. It's about speaking their language literally and figuratively. Sometimes, a playful approach or a familiar story can make all the difference. Get down to their level, make eye contact, and use a gentle, reassuring tone. This helps children feel respected and safe. Smile. It goes a long way. A warm, friendly expression can help break the ice and build trust quickly. Explain things in a way they can understand using words they know. Use analogies or examples from their everyday life to make things relatable. Don't underestimate the power of play and distraction. These techniques can transform a scary experience into something manageable. Toys, books, and bubbles can be powerful tools to reduce anxiety and create a positive environment. They help children focus on something fun instead of their fears. Remember, effective communication is key to building trust and making the anesthetic experience less daunting for both the child and their parents. When we connect with children on their level, we help them feel safe, supported, and ready for their journey. We all want what's best for children, especially when it comes to medical care. That's why parental involvement is so important in pediatric anesthesia. Parents are not only legal guardians but also the experts on their children. They know their child's medical history, allergies, and anxieties. Involving parents in the consent process is crucial. It's about explaining the procedure, the risks and benefits, and answering any questions they might have. But it's not just about the paperwork. It's about making parents feel heard, respected, and involved in their child's care. Remember to explain things clearly and sensitively, using language they understand. And when possible, involve the child in the conversation. Even young children can understand more than we think. By working together, we can ensure that children receive the best possible care in a safe and supportive environment. Children's bodies are still growing and developing, which makes them unique compared to adults in many ways. This means they react differently to anesthesia than adults, and their care must be tailored to their specific needs. Their airways are smaller, their metabolisms are faster, and their oxygen needs are higher. These differences can make even routine procedures more challenging. They are also more susceptible to heat loss, which can happen quickly in a hospital setting. Let's break it down further. A child's airway is narrower and shorter than an adult's, making it more easily blocked or obstructed. This means even a little swelling or mucus can cause significant breathing difficulties, so extra care is needed during procedures. Metabolism children have a higher metabolic rate, meaning they process drugs more quickly and may need different dosages or timing than adults. Oxygen needs their hearts beat faster, and they need more oxygen to keep up with their growing bodies, especially during stress or illness. Temperature regulation. Children lose heat more easily, making them prone to hypothermia during surgery or when exposed to cold environments. These differences are crucial to understand when providing anesthesia to children, as they impact every aspect of their care and safety. We need to carefully calculate drug dosages based on their weight, monitor their vital signs closely, and take steps to keep them warm and comfortable throughout their treatment. Just like we wouldn't use adult-sized clothes for children, we can't use adult-sized equipment in pediatric anesthesia. Children need equipment that is specifically designed for their smaller bodies. This includes everything from breathing masks and tubes to monitoring devices. We use pediatric stethoscopes to hear their tiny heartbeats more clearly. We have special breathing circuits that minimize resistance in their small airways. Drug dosages are meticulously calculated based on the child's weight, and we use specialized pediatric drug charts and calculators to ensure accuracy. Fluid warmers are crucial to prevent hypothermia, and we use warming blankets and heated mattresses to keep them cozy. And let's not forget the power of comfort items. A favorite teddy bear or blanket can go a really long way in reducing anxiety. Imagine being a child, scared of needles and unfamiliar places, lying in a hospital bed. The environment can feel overwhelming, with bright lights, beeping machines, and people in uniforms moving around. Surrounded by strangers, it's no wonder that induction of anesthesia can be particularly frightening for children. Their anxiety is completely understandable, and it's our job to help them feel safe. That's why we always use a gentle and reassuring approach. Inhalational anesthesia, where the child breathes in medication through a soft mask, is commonly used because it's less invasive and less scary than a needle. We often make it into a game, using play and distraction to help the child relax and even have a little fun before the procedure begins. Sometimes we let them choose a flavor for the mask, like bubblegum or strawberry, turning the experience into something familiar and comforting. We might tell them they are going on a magical adventure, or that the mask is a spaceship taking them to a faraway land. Sometimes we use picture books or even virtual reality goggles to help them imagine visiting a special place, making the process less intimidating. Throughout the induction process, we closely monitor their vital signs, making sure they are breathing properly and that their oxygen levels remain safe. We keep a careful eye on their heart rate, blood pressure, and other important indicators to ensure everything is stable. Our team is always alert for any signs of complications, such as laryngospasm, a sudden spasm of the vocal cords that can make breathing difficult, or bronchospasm, which is a tightening of the airways in the lungs, making it harder for the child to breathe. We are always prepared to act quickly and effectively if needed, ensuring the child's safety and comfort at every step of the way. After surgery, children need time to wake up fully from the anesthesia. This period can be a bit disorienting for them. They might experience emergence delirium, which is a state of confusion and agitation that can occur as they regain consciousness. That's why it's important to have a parent or caregiver present during recovery. Familiar faces and voices can be incredibly comforting. We provide pain relief medication as needed, using age-appropriate methods like sugar solutions for infants or patient-controlled analgesia pumps for older children. We also keep a close eye out for any potential complications, such as nausea and vomiting, airway obstruction, or breathing problems. We use gentle techniques to soothe and reassure them, and we make sure they have plenty of fluids and are comfortable. Working with children comes with a great responsibility. Their safety and well-being are our top priorities. We take extra precautions to ensure their safety at every step of the anesthetic process. Patient identification is crucial. We double and triple check their identity before administering any medications or starting any procedures. Drug calculations are meticulously checked and double-checked. We use age and weight-appropriate charts and calculators to ensure accuracy. We are also vigilant about safeguarding. We are trained to recognize and report any signs of child abuse or neglect. We maintain strict confidentiality and ensure that all documentation is accurate, detailed, and objective. Working with children in anesthesia is both rewarding and challenging. It requires a special set of skills, knowledge, and compassion. Remember, children are not just small adults. They have unique needs that must be met to ensure their safety and well-being. By understanding these differences and adapting our approach, we can make a real difference in their lives. Let's strive to provide the highest quality care to every child, every time.